Hello, thank you for joining us again today. Let me start, as usual, with the update on the statistics around COVID for Scotland. I can confirm that an additional 71 positive cases were confirmed yesterday. That represents 1% of people who were newly tested yesterday and takes the total number of cases now to 19,605. We'll have a full Health Board breakdown as usual later. My provisional information, though, is that 10 of these 71 new cases are in the Grampian Health Board area, 16 are in Greater Glasgow and Clyde, 4 in Lanarkshire and 31 are in Tayside. We're dealing with known clusters in each of these areas, and I will say a bit more about a couple of them later. I can also confirm that a total of 254 patients are in hospital with confirmed COVID, which is 5 more than yesterday, and 2 people are in intensive care, which is the same as yesterday. No deaths were registered of patients who'd first tested positive over the previous 28 days, and so the number of deaths under that measurement remains 2,492. That total, though, still and always should remind us of the overall impact of the virus. And again, my condolences are with everyone who has lost a loved one. And let me also again thank everyone who is working in various different ways across the country to help us through this challenging time. In a few moments, the Economy Secretary will talk about new investment in low-carbon heat for social housing, important for its own sake, but also important as a way of trying to boost the economy in these difficult times too. The main topics I want to cover today are outbreaks in Angus and Aberdeen. Before that, though, I want to draw attention to an important announcement that was confirmed last night. The Scottish Government has taken the decision to add 4 additional countries to the list of those that are subject to quarantine restrictions, and those countries are Austria, Switzerland, Croatia and Trinidad and Tobago. Each of these countries has seen a significant rise in COVID cases in recent days. So from 4 a.m. tomorrow, people travelling to Scotland from these places must self-isolate for 14 days on their return. In addition, Portugal was removed from the international quarantine list, so anyone arriving from there from tomorrow no longer has to self-isolate. However, if you have arrived from Portugal in the past few days, you still need to complete your 14 days isolation. These changes are a further reminder of how quickly the international situation can and is changing at the moment. And so I want again to take the opportunity to remind everybody and encourage everybody to think very carefully about booking non-essential trips overseas right now, because you cannot be sure and there can be no guarantee that the rules in place when you leave on your trip will be the same rules that are in place when you come back, either here or indeed in the country that you're visiting. Let me turn now to the outbreak in Angus, which is linked to the Two Sisters food processing plant there. I want to provide a bit of background. The Two Sisters plant, when agency staff are included, has more than 1,200 workers. Obviously, not all of the workforce live in Angus, so this is a situation involving people from at least 3 local authority areas, Perth and Kinross, Angus and Dundee. The plant is now closed down for a 2-week period, and all of the workers there have been advised to self-isolate and get tested. There's currently a mobile testing unit on site, and already more than 600 workers have been tested, and efforts are underway to ensure that the remainder will be tested as quickly as possible. I can confirm that as of now, a total of 68 cases have now been identified as part of this outbreak, 59 people who work in the plant and 9 of their contacts. 2 of these contacts have links to 2 other food processing factories in Tayside. The incident management team is now carrying out risk assessments at both of these sites. There's no evidence that this outbreak has spread to either factory at this stage, but as you can imagine, that's something that has been looked at very closely. Yesterday, I chaired a second meeting of SCORE, the Scottish Government's Resilience Committee, to look specifically at this outbreak because I wanted to consider the latest developments and what further steps might be required. NHS Tayside, Police Scotland and the chief executives of the 3 local authorities were involved in that discussion. And based on the advice of the incident management team, we agreed last night a very significant change to guidance. As well as advising workers at the plant to self-isolate, we are now asking all members of their households to do the same, and that includes any children in these households. Local authorities are contacting workers to advise them of this advice, but also to advise of welfare support that will be available. That could include, for example, help with food or other essential provisions, or even help with accommodation if that is necessary. We are, of course, continuing to advise all workers to get tested and making arrangements to facilitate that. Household members of workers should seek a test if they have symptoms. We've now deployed a second mobile testing unit to Tayside so that workers can get tested without having to travel to the factory, and we'll be considering whether further testing facilities over and above that are required. It's important to note that even if you are being asked to isolate, you must continue to do so even if you get a negative test result. And that doesn't just apply in Cooper Angus, that applies to anybody across the country. If you are asked to isolate, then if you're a contact, you should continue to do so for the requisite period. So to be very clear, if you work at the Two Sisters plant, you and your entire household should be self-isolating until Monday, the 31st of August. One final point I want to stress is that at the moment, although this has been kept under close review, there are only a small number of cases in Tayside which are not in some way linked to the Two Sisters site. And of course, we've taken prompt action which we hope will reduce the chances of further spread within the wider community. Now, these restrictions that I've just talked about are obviously more stringent than those that have been posed in other clusters. In those instances, we've asked contacts to isolate, but we haven't extended that advice to their families. On the other hand, in Dumfries, when we had the Gretna outbreak and more recently in Aberdeen, geographical restrictions were introduced. In Cooper Angus, we are able to target specific households with increased restrictions. And the key point I'm making here, because some people may be looking at Aberdeen and Cooper Angus and wondering why exactly the same approach is not being taken. And the key point I'm making here is that the nature of the steps that we take in different outbreaks have to depend on and be guided by the nature of the outbreak. The assessment of the incident management team in Cooper Angus right now is that there is minimal evidence of community transmission in Tayside. That's not something we were able to say with any confidence about the outbreak in Aberdeen. So as things stand, there is a clear focal point for the Cooper Angus outbreak, which was not the case in Aberdeen, where the outbreak was associated with a large number of venues across the city. So that's why the action we're currently taking for this outbreak is different to that we took in Aberdeen. In each of these cases, and this will continue to be the case in future, we make decisions based on the individual circumstances that we're dealing with. And in doing so, we take account of the specific risks that need to be addressed. And that's the approach we'll continue to take as we deal with different outbreaks in different parts of the country. We will, however, of course, be keeping the situation in Cooper Angus under very close review. And I will chair another resilience meeting this evening to look at the up-to-date situation and any developments over the course of the day. I now want to provide a quick update on the situation in Aberdeen, which is an improving situation, I am pleased to say. There were 10 new cases in Grampian yesterday. On the latest figures available, a total of 414 cases have been identified in the Grampian Health Board area since the 26th of July. 237 of these are thought to be associated with the pub-linked cluster, and 1,185 contacts have been identified from those 237 cases. Those figures are unchanged from yesterday. However, the incident management team is reporting an additional 7 cases that are not associated with that original cluster. On Sunday, as I indicated earlier in the week, we will review the lockdown restrictions in Aberdeen again. And at that time, we hope that we will be able to set out a firm timetable for the lifting of these restrictions. And at that point, we will also set out whether some of the changes that were announced more generally for the country yesterday, for example, the reopening of venues like bingo halls, will also apply in Aberdeen. But for now, I want to take the opportunity again to thank everybody in the city of Aberdeen for complying so well with these restrictions. I know how difficult it will have been for everybody, individuals, but also there will have been a real and very difficult impact on businesses that have been required to close and businesses in their wider supply chains. But this action was necessary to get this situation under control, and the evidence we have right now is that it has had that effect. So I think we all hope and are optimistic that Aberdeen will be on the road back, if not to complete normality, then at least as much normality as the rest of the country very soon. To close today, I want to reflect briefly on one of the key lessons that we've learned so far from some of the clusters we've been dealing with, and this is something you've heard me talk about in the past few days already. From all of the evidence we've got, it's very clear that indoor social gatherings are presenting a very significant risk. In fact, Test and Protect shows that these right now are one of the main drivers of transmission. And that tells us that we need to be incredibly cautious about these kinds of gatherings. So I want to ask everybody again today to remember the advice that is in place and to comply with it. Whether you're in your own home or in a friend's house, no more than 8 people from a maximum of 3 different households should be meeting up. And these same rules apply if you're gathering as a group in a pub, a bar, or a restaurant, and you should at all times make sure you're physically distancing from people in other households. Life at the moment shouldn't feel absolutely normal. I wish it could, but it can't and it shouldn't. So if you're going to lots of different places, if you're socialising just like you did before COVID struck, you're probably taking risks that you shouldn't be taking. So please think about the decisions you're making right now. All of us now, probably more than ever at any previous point in this pandemic, are dependent on each other as we're out and about more to stick to the rules and avoid the risks of transmission. Every single one of us has a part to play in this. And the best way that all of us can do that is by remembering and sticking to facts. So I'll bring my comments before handing to the Economy Secretary and then to the Chief Nursing Officer to a close by reminding you of those 5 golden rules. Face coverings in enclosed spaces, avoid crowded places, clean your hands and hard surfaces regularly, 2 metres distancing remains the overall rule for people from different households, and self-isolate and book a test if you have symptoms. If we all comply with these rules, we don't take away completely the risk of this virus spreading, but we do massively reduce that risk, and we reduce the risk of 1 case becoming 2, and then 2 cases becoming a cluster becoming an outbreak, and then an outbreak becoming widespread community transmission. So every single one of us is part of that first line of defence. So my thanks to everybody for listening as usual, and please help us spread that word to all of the people in your families and wider networks of friends and colleagues. I'll hand over now to Fiona Hyslop, who wants to say a few words about the housing initiative I spoke of earlier, and then I'll hand over to the Chief Nursing Officer, who's going to say a little bit more about the forthcoming flu season.
Thank you, First Minister. In addition to the health impacts, we are all acutely aware the COVID crisis is already causing serious damage to the economy in Scotland and around the world. The GDP figures out this week show the scale of the challenges we face here in Scotland to rebuild our economy, with GDP still 17.6% below pre-COVID position, despite it growing by 5.7% in June. So while there are very early signs that our economy is beginning the long road to recovery, we must continue to be cautious in our approach and adhere to the guidance put in place to ensure that the tentative progress we are making is not derailed. As the First Minister outlined yesterday, we remain in phase 3 of the route map, with more indicative dates given for the reopening of the economy in August and in September. We know many companies are keen to get confirmation of when non-essential offices can reopen, and while the time is not right now, this week we published guidance so that businesses can undertake planning work with safety at its heart and make reopening safely easier when the time comes. And as we move forward, we will continue to build on the advice and the expertise from a range of experts to help reshape our longer-term economic recovery. We're taking forward the recommendations of both the Enterprise and Skills Strategic Board and from the Independent Advisory Group on Economic Recovery, our responses to both of which focus on building a green economy with protecting and creating jobs, digital and well-being at its heart. And we will use £66 million of our £230 million economic stimulus package to create high-quality green jobs, support the transition to renewable energy sources, fund research in future transport, and deliver renewables and decarbonisation projects across our country. And today I am pleased to announce that £200 million of funding for low-carbon heating in our social housing stock has now been fast-tracked as part of our COVID response. The majority of this investment will be made in the coming year through the Social Housing Net Zero Heat Fund and will support construction of shovel-ready projects. The fund is open from today and is available to local authorities, registered social landlords and energy service companies supplying heat to social housing. Eligible projects include upgrading inefficient electric storage heating, connections to low-carbon heat networks, installation of heat pumps and biomass boilers to replace fossil fuel heating systems. And the fund will deliver rapid investment to support jobs in both our energy and our construction sectors and will help reduce bills for those who have been worst hit by the economic impact of the virus. And it's so important that we never lose sight of the human impact of this virus. The health impacts are clear and the economic impacts are also devastating, with livelihoods under threat and individuals and families around the country left facing an uphill struggle to survive financially. The UK Government furlough scheme has provided some much needed protection for many households, with figures today showing almost 800,000 people have been furloughed in Scotland for at least part of the period between March and June. It has also undoubtedly enabled some businesses to stay afloat. But that vital safety net is due to be pulled from under people in just 10 weeks' time. We have again and again asked the UK Government to reconsider the premature ending of this lifeline, with indication given this week that Germany is likely to extend their furlough scheme to 2 years. The United Kingdom really must think again about withdrawing blanket support. That is why today we've written once again to the Chancellor to make the case for a targeted extension which could continue to provide support for the sectors that have been most heavily affected and where we do not expect businesses to have recovered by October, such as tourism and hospitality. And it's also clear that people should not be made to choose between complying with public health restrictions and being able to survive financially. Therefore, I've also asked the UK Government to provide support for businesses and workers in the event of local lockdown arrangements being put in place to manage outbreaks. And I'm also asking them to provide support for individuals who are told to self-isolate for 2 weeks through the Test and Protect scheme and cannot work from home. And we know this latter point disproportionately affects workers on lower incomes as they are less likely to be able to work from home. So it's no exaggeration to say this support is a vital lifeline. Families and businesses across Scotland are dependent on it to survive financially, and we must do all we can to ensure they remain protected.
Thank you, First Minister. I want to talk for a moment about our child flu vaccination programme, which is part of the Government's overall vaccination programme that many of you will know runs every year. This seasonal flu vaccination programme helps to protect the most vulnerable in our society and alleviate pressure on our NHS. And this winter, that's going to be even more important given the pressures that COVID-19 have put on our health service and that we want to guard against and protect people as much as we possibly can. So this year, more than ever, it's going to be critical that those who are eligible for the seasonal flu vaccine this year take up that opportunity. And I would like to say to everybody who is used to taking up the opportunity of the flu vaccination programme that this year the arrangements will be slightly different. People who are used to picking up the phone to their GP surgery to make their appointment may not be doing that, and Scottish Government is working with local boards who are working with local GP practices to make sure that we have COVID safe and COVID secure arrangements so that we have appropriate PPE and social distancing when we run our immunisation programme. So please do look out for the letter that will invite those who are eligible for the flu vaccination programme, because it may be that your arrangements are going to be slightly different from the way they are every year. And for children, flu can be serious and result in otherwise healthy children being hospitalised, and the flu vaccine remains the best and safest way to protect your child against flu and its complications. And not only that, it also protects other more vulnerable people from catching flu from children who haven't been vaccinated. So we would be encouraging all parents and carers to support the vaccination programme and support their children's health and well-being by having them immunised. And the only way primary school children can get their flu vaccination is that parents and carers sign a consent form. So I would encourage parents and carers to dig into the school bag. These consent forms are beginning to appear in primary school bags from now. And if the consent form is signed within 7 days and returned to the school, then your child will have their flu vaccination at school, which for children aged 2 to up to primary 7 is a nasal spray. So it's a very easy, quick and simple remedy to stop children from having flu. So our primary school aged children will be offered vaccination at school, and children aged 2 to 5 who are also eligible for the vaccination, letters will be received. So look out for them through the post from mid-September, setting out what these arrangements will be to have preschool children vaccinated. Thank you.
Many thanks, Fiona. I'll move straight to questions now. David Wallace-Lockhart from BBC Scotland.
Thank you, First Minister. From a public health perspective, is it a concern that you currently have a rush of travellers trying to beat a 4 a.m. quarantine deadline? And is there a danger that undermines the whole point of the exercise? Can I also ask quickly, Scottish Labour leader Richard Leonard has reiterated calls today for a national care service, one without a profit motive. Do you accept the pandemic has shown the care service is broken, and would you support his calls?
I've already expressed my general support for reform in the social care sector, and my general sympathy for the notion of a national care service. I'll set out more thoughts on that in due course. Right now, of course, I'm very focused on dealing with the here and now and continuing to get the country through the pandemic. On the quarantine issue, look, when we decide a country poses a risk of importation of the virus, we can't hang about before we impose quarantine. Otherwise, there would be no point in doing that. So the decision has been taken around the countries that I listed earlier on, and that will come into force from 4 a.m. tomorrow morning. And I know that causes problems for people, which is why I've been at pains to say to people, think very carefully about going abroad for non-essential purposes right now, because you might find yourself in the position of the rules changing, and if you don't get back before a certain time, you will have to quarantine. And that has happened in the past with Spain, with France. It's happening to the countries I've talked about today, and next week I can't guarantee it won't happen to other countries. We're in a global pandemic, and the situation internationally is very volatile. The situation domestically is volatile, and I really do think it makes sense to give careful consideration to perhaps not going on non-essential overseas trips right now. I can't make those individual decisions for people, but it is my duty to tell people that these rules might change, and therefore these are considerations you really have to take into account.
Well, why a 4 a.m. deadline? Why not immediately?
Well, because we have to give the border force a bit of time to get the practical arrangements in place. People can argue this one way or the other. I've heard people say, do it immediately, and then people say, give days notice. We have to give a bit of practical time for those who administer the systems to adapt, but we do it very quickly. And that's the right approach. None of these things are absolutely black and white and straightforward. I keep saying this every day, not to try to attract any great sympathy from anybody. That would not be appropriate. But these are difficult decisions, and we're in a very, very volatile, unprecedented situation right now that none of us have dealt with before. So we're trying to strike the right balances on these things. But instead of us standing here and talking about, what is the best thing to do for people who are overseas, and you will always have that because people will make the decision to go overseas. My main message is think very carefully right now about whether you want to find yourself overseas when these rules are changing. I don't want to overly state the obvious here, but this is a global pandemic, and there are signs right now that it is accelerating again in some parts of the world. We have some signs that it might be increasing again here in Scotland. And I think everybody just has to remember that when we're making decisions that a few months ago we would have taken without thinking too much about. We've got to be a lot more cautious and careful about these decisions right now. Louise Hosey from STV.
Yes, thank you and good afternoon. First Minister, this week we've seen a number of coronavirus cases confirmed by schools. Can you say how likely it is that it will now become compulsory for pupils to wear face masks at schools, in particular at secondary schools? And just touching on the Cooper Angus situation, how confident are you that these further restrictions will be effective? And what provisions have been put in place for those children who will now have to self-isolate with their families?
On the first part of your question, and this is a general comment, I'm not, Louise, sort of picking up on your language particularly here, but I think we've got to be really careful about language. These are cases in the main that are, and certainly with the young people involved, they are cases of coronavirus that are being confirmed through test and protect, through the testing system in children and young people. They are not cases that are being picked up in schools or identified by schools in that sense. This is community acquired COVID that happens to be in people who have links to schools. Now, that might sound a bit pedantic, but it is really important that we understand that so that we don't, this is not me standing and saying we will never have cases that are acquired or transmitted in schools, because we may well do, although we take mitigating action to try to reduce the risk of that. But I think it's really important right now that we understand that it's by keeping community transmission under control that we best minimise the risk of the virus in schools. But you've raised rightly the need to keep under review the different mitigations. There is guidance in place right now that has been informed by the scientific advice the Scottish Government took on that, and our scientific advisors look at all of the evidence, not just here in Scotland but from around the world. That evidence is developing all the time because this is a new virus that the knowledge of is developing literally every day and every week. So we will keep that under review, face coverings in particular. I do think there is a possibility that our advice on that may change. The Deputy First Minister is today chairing a meeting of the Education Recovery Group where I'm sure that will be one of the issues under discussion. So if and when we change guidance on any aspect of how we tackle this virus, we will set it out in the normal way and as clearly as possible. But I want parents and young people to be confident that the guidance that is in place right now is guidance that has been informed by scientific advice. And lastly, on the issue about Cooper Angus, I suppose, just to be clear, we have to keep these things under constant review. We have incident management teams looking at all of these outbreaks. They assess the cause of the outbreak, they assess the patterns and likely patterns of transmission, and they make recommendations. But we're dealing with an infectious virus where I can't stand here and guarantee that any measure we're taking at any particular time will be 100% effective, which is why we have to keep this under review and why I personally chair meetings of the Scottish Government Resilience Committee. I first, on Cooper Angus, did that on Wednesday. I chaired a second one last night. I will chair another one this evening to make sure that if we need to take further steps, then we are able to do that. But the point I think it's really important to be clear on today, because people will look at different outbreaks and see different approaches. The approaches have to be tailored to the specific nature of the outbreak. And an outbreak that starts in one particular factory is different in nature and will require a different response to an outbreak that starts in a number of pubs across a city. So we will tailor these responses, but obviously keep them under review. And on your question about school pupils, the councils involved, Perth and Kinross, Angus and Dundee, were on, as I said, the resilience call last night. They are all actively engaged in contacting all of the workers from the plant, making sure that they are offered the advice that they need to hear and act on, but also offered any support that they need. That may be support in terms of getting food or medicines. Some people may need accommodation support to self-isolate, so that councils are actively engaged, literally as we speak, in making sure that that is available. And obviously schools will have knowledge of any of their young people that might be absent because they are part of a family associated with the factory. Becky Clark from Global.
Good afternoon, First Minister. On the issue of schools, we've heard from a teacher today who says he fears for his life and wants a return to blended learning as more and more pupils refuse to follow hygiene measures and are bullying other pupils who want to wear face coverings to ditch them. Another school's warning that pupils vandalising hand sanitisers could be excluded if it continues. How concerned are you about these situations when at least 2 schools have had to close this week because of cases and for deep cleans? And what's your message to pupils who appear to be pressuring others into not following the rules?
I'm not going to respond to anecdotes there, about kids bullying or vandalising things. If there are specific instances of that, they should be dealt with properly through the normal channels in a school. But let's not be complacent about issues like that, but equally let's not get into a position where we are bandying about phrases like widespread bullying or vandalising of hand sanitisers. This is a difficult situation for everybody who's involved in dealing with it at the front line, and we've got to deal with these issues calmly as we can in a global pandemic, and systemically, driven by evidence, and being prepared to adapt our approaches as we need to. And the guidance in place in schools will be kept under review, but it has been carefully developed thus far. And I understand the anxiety of teachers, which is why what I would ask people to do is take some assurance from the fact that schools are acting on a very precautionary basis. And I'll repeat a point I made to Louise, that remember, what we are dealing with right now is not transmission of this virus within schools. Nobody can say that will never occur. But what we're dealing with right now are pupils or teachers who are tested positive for COVID. And because they have an association with the school, they may have briefly been in a school, or they may have a contact they've been in a school, schools are acting on a precautionary basis. And whether that is a temporary closure for a deep clean or whole classes being asked to isolate, that is part of making sure that we're taking the most careful approach to avoid further transmission. And that's important, and we will continue to do that and support schools as they do that, as we keep that overall guidance under review. Neil Pooran from PA.
Thanks, First Minister. I was wondering if you're aware of the situation at the Trump Turnberry Resort. The RMT union says that the Trump organisation is making more than 80 workers redundant there, and they say that the organisation's using the pandemic as a shameless guise, as they say, for decreasing terms and conditions. The RMT is calling for the Scottish Government to step in on this. Is that something you would consider?
I don't know what the situation is at Trump Turnberry in terms of the issues you've just outlined there. I'm happy to go. I'm not sure if the Economy Secretary has more information than I do right now. Happy to look into it. I would say to all businesses, whether they are Trump businesses or any other business, and I think the vast majority of businesses in Scotland are operating in this way, that be responsible to your workforce during a difficult time. Fair work is vital at any period, but it is particularly important right now when everybody is suffering really difficult challenges, and no business, and I don't think the vast majority of businesses in Scotland would operate in this way, should be using the pandemic as a way to do things that they wouldn't otherwise do. We all have to work through these difficult challenges collectively and in that spirit of solidarity.
And it's important, if we look at the furlough scheme, to make sure that the strengths of that are not undermined by any individual organisation. And I don't understand the details of this case, but we're happy to look at that. But I also would echo, I think, what the UK government has said, that they wouldn't want to see NMD misusing the situation just now in terms of redundancy, or indeed in misusing the furlough scheme as a cover for redundancy. And that's something that the UK government ministers that I've spoken to are actively looking at, to ensure ensure that they can prevent that. And indeed, I think in recent days, the Chancellor himself has said that he's identifying 3,000 firms that they want to look at in terms of how they've used, obviously, furlough schemes, but at the same time are looking to make employees redundant. Now, that's going to happen in different sectors. It will happen in the hotel sector. But right at the beginning of this process of COVID, and right through this, we have put fair work principles at the heart of that. We agreed a fair work principle update with the Institute of Directors, the Scottish Council Development Industry, the STUC, and also COSLA, because it's really important at difficult times that the rights and positions of the workforce are protected, because we will need them as part of the recovery, and certainly we need to do so in a way that protects their rights, particularly in employment areas. And of course, employment areas, as you know, are reserved to the UK Government.
Conor Matchett from the Scotsman.
Thank you, First Minister. Just on care homes, if possible, Richard Leonard said today that he would support, and Scottish Labour would support, families taking care home providers and potentially even the government to court over potential cases of positive COVID cases being discharged into care homes. Would you support families in that if they decided to take these cases to court?
It's completely inappropriate for me to talk about legal action that anybody may take, either civil or criminal. People, of course, have a right to pursue any legal rights that they think they have, and to pursue any legal redress that they think they have. And as a general principle, that's one that I think everybody adheres to. On the issue, I'm afraid I've not had time to hear Richard Leonard this morning, but it's very easy for people who've not had to take these decisions and who don't have the benefit, or do have the benefit rather, of the hindsight that those of us taking the decisions didn't have when we took those decisions, to say what should have happened. And I've been an opposition politician. I'm not criticising for that, but it is an easy thing to do. We're living through a really difficult, unprecedented situation right now, and all of us in positions, not just in Scotland, but worldwide, I'm sure maybe with one or two exceptions, in these positions of taking the decisions, are trying to do our very best to get the decisions right, and changing course where we think we need to because of the changing knowledge and evidence. And I've said many times in the past, and I'll no doubt say it many times in the future, none of us will have got everything right. It would have been inconceivable for us to have got everything right, given the nature of what we're dealing with. But what I don't think is reasonable is for people to question the motives of us trying to do the right things in these things. And, accountability and learning lessons from all of this is going to be really important, which is why we've already committed to a public inquiry when, we get to an appropriate stage in this. We've ourselves commissioned Public Health Scotland to do more analysis of people who were discharged from care homes from hospitals into care homes, and the testing situation around that. So it's really important we understand that, but we are still in a pandemic where we're still having to take really difficult decisions, and those of us who are in positions of responsibility having to take them, I think it's really important that we stay focused on that and stay focused on trying to take the best decisions we possibly can. Tom Peterkin from the P&J.
Good afternoon, First Minister. You say that the situation in Aberdeen's improving. I just wondered how confident you are that it's being contained in the city and not spreading to the Shire and Murray, etc. And on the Cooper Angus outbreak, the households who've been told to self-isolate, do you have numbers for how many adults and children that actually concerns?
On that point, I don't have the number for that because obviously we don't know how many household contacts every person who works there have. We may be able to give some more numbers, even estimated numbers of that later. But we do know there's around 900 permanent workers and there's another 300 or so agency workers. So clearly we are talking about a significant number of people that will be in the several thousands. And that is why I'm making the point that this is a significant step we are taking. But because we are trying to limit transmission and we know there's a focal point for this outbreak here, if we do that effectively, then we hope we can avoid wider community transmission. On the point about Aberdeen, there is no evidence to suggest that there is wider transmission beyond Aberdeen City. That's something that has been looked at very carefully, particularly around Aberdeenshire, given some of the travel patterns and proximity of different communities there. And we think in Aberdeen now, the cluster itself is coming under control. There has been an ongoing concern about cases not associated with the cluster, but we think it is an improving situation. But we need to keep closely monitoring it so that before we start lifting restrictions, we are sure that it is properly under control. And that will be the data and the evidence that's looked at over the weekend as we come to that review point on Sunday. Michael Blackley from the Daily Mail.
Hello, good afternoon. To return to the furlough figures that were out today, they confirmed that the number of furloughed jobs actually increased by 45,000 between the end of June and the end of July. I'm interested, is that a bit of a concern to you that we're actually still pretty reliant on furlough and that the economy isn't getting back up and running and people back to work? And you yesterday didn't put a date on the return of non-essential offices. Do you have any fears that could actually result in some of these furloughed jobs becoming redundancies pretty quickly?
I worry about that if furlough is removed sooner than it should be, and that is possibly in this area my most significant concern right now. And unfortunately, that's not a decision I control. But that's why we're making the case so strongly to the UK government that they should not prematurely withdraw furlough. Earlier this week, the German government extended their equivalent scheme to up to 2 years. So I think that is a significant concern right now. I set out the reasons why we didn't put a date on the opening of non-essential offices. We'll review that again in 3 weeks' time. Basically, where we are right now, if I can try to put it as bluntly and as simply as possible, if we try to do everything right now, we'll end up being able to do nothing because the virus will get out of control again. So we have to keep a balance. And our judgment is, given the numbers of people and the travel patterns this would cause, if all non-essential office and call centre workers went back into their office accommodation right now, the impact on transmission would be so great and we would risk having to close down things that are already open. So that's the balanced judgments we have to continue to try to take, and we understand the implications of that for businesses across the country. I'll hand over to Fiona on the furlough scheme more generally. We did see in the most recent month GDP figures out earlier this week, growth return to the economy, but we are still in a global pandemic and every country will be experiencing the economic impact of that, which is why it's really important that support for the economy, whether that's furlough or other forms of support, are not taken away before the country is ready to cope with that.
Can I also point out that even before the announcement yesterday, about 90% of workplaces were still active. Now, some of them, obviously, like non-essential offices, had people working from home, but they've been working right through this period and quite often under pressure situations, particularly if they have young children. And in the conversations I've had with businesses this week, everyone I've spoken to have been proactive in saying the difference that having the schools back has made to their workforce and in a positive way. So I've said before that support for the economy and economic growth is reliant to a great extent on a number of factors, not least getting schools back. And I think we should recognise that. In terms of the issues around furlough, it's quite complex because remember the issue around flexibility of the furlough to help companies restart was one of the reasons that we campaigned and argued for the flexible working of the furlough, so people could bring people back on a temporary basis and on a part-time basis, and some of their staff, perhaps not other members of the staff. And I think that's what you're also seeing. So it's quite a complex period, but it also shows how fragile that restart is for many companies. And it's not necessarily because of the factors you might think. Some of it's because of lack of demand, global demand for companies, for example, and some of it is that they're not quite yet at full capacity for the work that they're conducting in terms of their productivity. So these are all the issues that we're working on with businesses, making sure with our enterprise agencies we can provide that support. report, but I think it underlines why other countries like France, like Germany, and I think Ireland are supporting their furlough scheme on a flat basis right through to March 2021, that although we've got the early start of growth, we've seen that with the June GDP figures, this is a long road to recovery. It will not be instant, but we have to make sure it's sustainable and we can get as many people kept in jobs where possible, but also look to create new jobs for the future.
Simon Johnson from Telegraph.
Good afternoon, First Minister. I'm sure you were delighted to see from the front page of this morning's Daily Mail the Prime Minister heeding your advice to take staycation in Scotland. But I understand a Visit Scotland marketing campaign has not been extended to England yet. I just wondered whether that should be done, given obviously it's such an important market and the industry is struggling so much. And as a second question, I just wondered whether you would feel comfortable having a holiday in England at the moment, given the prevalence of the virus there.
Unfortunately, I'm not having the opportunity to get a holiday anywhere right now. I don't criticise anybody, incidentally, for taking a holiday. That's not the purpose of this comment. But my place and job right now is here in the Scottish Government headquarters, given what the country is living through right now and the volatility we face. So I'm not anticipating taking a holiday in Scotland, England or anywhere else for the foreseeable future. No doubt much to the chagrin of my family, but there you go. On the Visit Scotland point, look, people in England are welcome in Scotland, always have been, always will be, and there is no dubiety, no debate about that. But we're in a global pandemic where we have to be careful about whether or not we are encouraging people to come from other parts of the world to Scotland right now, based on prevalence of the virus. And decisions around the Visit Scotland campaign in England were taken, as I understand it, around the time we were seeing some outbreaks in the north of England. And there's a difference between saying people are always welcome, but during a pandemic, we might not be actively marketing and encouraging people to come to Scotland from any other country in the same way we would do in normal times. And these are just basic public health driven decisions that we're having to take right now as we try to get and keep an infectious virus under control. Tom Martin from The Express.
Hi, thank you, First Minister. Just returning to the situation in Angus. Obviously, you made clear, this is a targeted intervention at this stage. I just wondered, though, given what you've said about, there's people are coming in or travelling around 3 different areas, what other specific measures you may be considering that might be necessary? And secondly, if I could just pick up, you were talking again about indoor gatherings being a main driver in infections at the moment. Have you got any figure or a proportion of cases that involves?
I don't have a figure in front of me. We'll always see if we can provide more figures to illustrate the points we're making. But we know in some of the smaller clusters, the one that has been dealt with in the northeast of Glasgow and Lanarkshire, 2 separate clusters, but they are linked, that there is a very strong link there to an indoor house party, to be frank about it. And that's been the case in some other clusters we've been dealing with. In Aberdeen, it's not house parties, but indoor hospitality that's driven it there, which is, so indoor house social events and indoor hospitality are 2 of the key risk factors, which was why we announced some further enforcement action around both of these areas yesterday. I'm going to hand over to the Chief Nursing Officer to say a bit more, just perhaps about the different natures of outbreaks and how that drives our response. At the moment, because this is an outbreak that started in a factory, so we've got a defined group of workers and a defined group of their household contacts, we think there is a real possibility of containing it with targeted action on that big group of people, but smaller than we had to target in Aberdeen, for example. Now, the restrictions we're putting on that group of people are quite severe, and more severe, actually, than the restrictions on a bigger group of people in Aberdeen. If we thought that hadn't been successful and we had wider spread or the risk of wider spread community transmission, obviously we would have to look at more community-based restrictions. But I don't want to start to speculate on that right now because it's not the position we're in. But I think the point, we're all learning about how we tackle these kind of outbreaks right now, that it will not always look the same in one area to another because the nature of it will drive the response and how we try to stop it becoming a targeted outbreak to one that is got much wider community implications. Do you want to add to that?
Thanks, First Minister. We're very fortunate in Scotland to have incredibly experienced and competent health protection teams and public health teams who are well versed in incident management teams, whether that's outbreaks of salmonella or Legionella. They're well used to looking at an incident, making decisions about how best to protect the public and putting these control measures in place. As the First Minister said, we're getting used to coronavirus. Things are changing. We're learning more and more about it. And what we do know is that once one member of a household has the virus, then the rest of the household can often succumb to it as well. And given the proportion of staff in the factory who are positive, it was thought that that was an appropriate measure to again try and contain the virus and stopping leaching out into the wider community. And many areas are thought through, seeing that the virus is controlled and making sure that other people are not exposed to it is clearly first principles. And other mechanisms that can be put in place are, of course, looking at whether it's travel restriction, looking at where people are likely to go, whether it is indoor gatherings or other areas that would then mean that has to be stopped so that the spread of the virus can be controlled. I think one of the other areas that we're very fortunate in Scotland is that close-knit community whereby we can monitor and take cognizance of what other outbreaks are happening nearby, just to check and make sure that we're confident that the incident in this case in Cooper Angus is related to factory, isn't showing any other spread, and therefore the control measures in place at the moment are appropriate.
Derek Healy from the Courier.
Thank you, First Minister. Just to follow up on that last question, the Scottish Government's latest modelling report highlights 6 areas where the number of cases was higher than expected. Had 6 areas where the number of cases was higher than expected levels at this stage of the epidemic. Perth and Kinross and Dundee, where many of the Two Sisters employees live, were the only 2 areas where exceedance levels were above the threshold, where local transmission is seen as being at a higher risk and may require greater vigilance. How comfortable are you that the measures being taken in Tayside at the moment will be sufficient to get on top of this outbreak without needing further measures?
I think I've probably covered this at length already, so I'll be reasonably brief. We had a resilience meeting last night where the chair of the incident management team gave a very detailed update on the current situation and made a recommendation that was endorsed by the resilience team to extend this advice to isolate to household contacts of workers. And the basis for that was the incident management team has, as all IMTs will do in these circumstances, has looked at the cases, and the conclusion is that there is a very small number of cases in Tayside, which would not be all that much different to elsewhere in the country, that are not associated with the Two Sisters outbreak. So that leads them to think right now it is the Two Sisters workforce and people immediately around them that measures should be targeted on in order to contain this spread. If I could contrast that with Aberdeen, at a similar stage in Aberdeen, we had a number of cases that were spread or could have been spread across a number of pubs across the city. So there was clearly much more of a worry that it had already seeped into wider community transmission. So the response there had to be wider spread across the community. So, I'm not a public health expert here. I listen very carefully and try to act on the advice of those who are expert. And that's the clear advice at the moment of the incident management team. But later, early evening today, I will chair another of these discussions. The incident management team will give us, no doubt, the same kind of update they did last night, and will make any further recommendations that they think are necessary. That's how these things have to be dealt with. So I can't stand here and say for absolute certain that we won't require to do anything further. But what we are doing right now is very significant. This is a large number of people that are being asked to self-isolate, not to restrict their travel to 5 miles, as was the case in Aberdeen, or not to go to pubs, but to self-isolate for a 14-day period. So this is significant action, and we will continue to keep it under close review. And the local incident management team here, the councils, the NHS board there, I think are doing a really good job at understanding and getting as far as they possibly can on top of this to hopefully mean that we won't need to apply any greater or more widespread restrictions, but we monitor these things on an ongoing basis. Christine Lavelle from The Sun.
Thank you, First Minister. There's a warning today from the Scottish Passenger Agents Association that the travel sector is facing imminent decimation. They've called for a move towards airport testing and follow-up checks to cut the length of quarantine time for passengers from overseas. I just wondered, is this something that you're considering, and how closely are you looking at countries like Germany where a system of airport testing is in place?
I'll hand over to Fiona Hyslop in a second because she's had some recent discussions with some airport interests. I think you've asked me this question before, Christine, and my answer is probably not much different to the one I would have given you before, or whoever it was, if it wasn't you who asked me it. We are looking at these potential alternatives to quarantine, and we are also looking at experience in other countries. Effectively, what this comes down to is a balance of risk. What we're trying to do with any measure, and we're doing it through quarantine at the moment, is mitigate against the virus being imported into Scotland from other countries where prevalence and risk is higher. And there is no system of doing that is absolutely foolproof. The question is, which system gives you the best protection? The problem with testing is that, certainly if you tested somebody on arrival here, and they tested negative, and then so you told them, well, you can go away and not bother quarantining, you have no certainty that they wouldn't test positive the next day or 3 or 4 or 5 days later. So I know one of the proposals that has been talked about and has been looked at is you test somebody on day 1 and then you test them again at day 8, and that might give greater protection, but does it give sufficient protection that somebody wouldn't then become positive on day 9, 10, 11 or 12? Because we know this virus, broadly speaking, has a 14-day incubation period. So effectively what we are trying to work out is what gives us the best overall chance of avoiding the virus being imported. And we will continue to look at all of these options and come to balanced decisions. And we'll discuss, of course, with the other nations across the UK as well. Fiona.
So clearly the incubation period of 14 days is critical to the quarantine system that is currently in place. But we also understand the real problems that the travel industry, the tourism industry, the aviation industry is following. And in terms of the collapse of the market, not just here in Scotland, but across the world, there are real challenges. And other countries are looking at different systems. And I think it's important that we do look at different systems, but there's not any immediate solution facing us as of now. But I think it's important that we continue to engage with the aviation industry for a whole variety of reasons, for employment, jobs, engineers, etc. But as far as the airports are concerned, I had a very constructive meeting with the CEO of Edinburgh Airport yesterday, and we've agreed to work together on a whole variety of different issues about ensuring that we can have some kind of sustainability for the airport and indeed others in Scotland as we come through what is going to be a very, very difficult period indeed. But I also agree with the UK Transport Secretary, Grant Shapps, who said in response to this as well that it's not quite as simple as suggested. And I think the First Minister's remarks have explained why it isn't as simple as everybody's saying as of now. But I think we also have to be duty-bound to think about lots of different things in how we can mitigate problems in the future. And obviously that's why we have to have those discussions, but to do so in a way that is constructive and respectful of the public health advice, the economic impact, but also the individual jobs and the institutions and businesses concerned.
Clinically, the most effective way to stop spread from coming in from another country is to quarantine for 14 days. And we know that there have been outbreaks that have been caused or contributed to by people coming from countries that have been quarantined, and they themselves have put other people at risk for not staying at home for the 14 days. As already been talked about, there's a mosaic of information. If people aren't going to quarantine from 14 days, it may well be that it's more effective to do the test and release people. And as the First Minister and Ms Hyslop said, these things are all being actively considered by public health so that we can then give that information and that evidence to be taken into consideration alongside other key and important areas.
David Ball from the Herald.
Thank you, First Minister. can I go back to the low carbon heating announcement and just how many homes we can expect this and will be able to be for carbon, and what role do you expect the private sector to play in transforming Scotland's homes to low heating, given that retrofitting buildings can be incredibly expensive?
In terms of that fund that's available now, obviously it will depend on the applications and indeed the cost of those on an individual collective basis, how many homes will be able to be affected. It was difficult quite to hear that line there, so I hope I'm answering and we can give you more information after this as required. But you're right that the issue around mobilising private finance as well as public finance in the massive challenge ahead for us, and not just to make sure that we have our targets on climate change reached by decarbonisation of our energy systems, but the retrofitting of housing for green energy will also be an opportunity for job creation. There's the whole pipeline of activity that's required around that. We know that our Scottish energy companies are standing ready to invest billions in terms of provision of green energy on the electrification of Scotland, but also there are great ambitions in some other areas in energy as well. And to unlock that private investment will take a concerted effort, yes, from the Scottish Government, and in volume of amounts that are far more than the announcement today. The announcement today is instant, it's shovel ready, it makes sure that we can make an impact as of now. But I look forward to hearing more information from our infrastructure investment plan, our climate change plan, and our programme for government. It will set out our ambitions and vision in this area. I'm very excited about the opportunities of this, but underpinning that is that twin track impact of creating jobs, but also making sure that we can improve the energy efficiency of our housing stock.
Thanks. Andrew Learmonth from the National.
Thanks, First Minister. I've got a question for the Culture Secretary. Scotland's comedy clubs, including the Stand, the Monkey Barrel, the Gilded Balloon, are all having to consider redundancies at the moment. Even if they get the go-ahead to reopen on September the 14th, social distancing in what are relatively small rooms will make it tricky to run at anything other than a loss. These grassroots clubs have received no funding from Creative Scotland and the Scottish Government in the way that grassroots music venues have. There's a feeling among comedians that that's because historically they've not been seen as a proper art form. The venues are pretty sure that unless funding is made available, they won't survive. So I suppose the question for the Cabinet Secretary is, do you think comedy is an art form, and what help can you offer?
Yes. Yes, I do think comedy is an art form, and no, you're wrong that actually comedy venues have benefited from the Scottish Government's support. So, for example, the Gilded Balloon, one of the venues that you've identified, has received Scottish Government support. So, along with other culture areas and sectors, we've had continuous dialogue. I've already announced significant funding. We've just seen the announcement and opening of the grassroots venue for music. But I am quite clear that we need to work across all the different art forms to identify and support venues, but also individuals. So the freelance support that we had very quickly, the bridging bursary that were open for comedians as well as MDLs right at the beginning of the pandemic was something that was very much welcomed by freelancers. So we're already and have been in discussion with the Live Comedy Association. And so I think in terms of your premise of your question, you probably underestimate the activity that's already been engaged in, and also are anticipating an answer that I think will be surprising to you if your position is you think we're not going to be supporting that sector. So I can't give the announcement now. There's a number of areas that we've not been able to do that as yet. We've helped support theatre venues already, performing arts venues, and I think in terms of the thinking in Scotland, we're capable with the connections that we have in Scotland across the different art forms to help venues, but importantly help freelancers. And I'm in active discussion with Creative Scotland and hope to have announcements soon that will benefit not just comedy, but the rest of Scotland's strong, vibrant culture sector, which is so important to Scotland's well-being.
Arts and culture are not just now, but at every single time so essential to not just the economy, but the health, well-being of the country. Comedy, in my view, is a very fine art form, and perhaps in these challenging times, it's also a particularly valued art form, and we should not lose sight of that. So as Fiona said, we're providing support in a range of ways. There's a question right now about whether any support is as much as we would want to be given in an ideal world, but we will continue to work really hard to target support where it is needed and where it can have most benefit, and certainly comedy as an art form is very much included in that. Lastly, Kieran Andrews from The Times.
Thank you very much, First Minister. Chief Superintendent Andrew Todd of Police Scotland said that a fall in the detection rate for housebreakings in Tayside was because officers have been, quoting him, directly impacted by some COVID-19 restrictions and social distancing measures. I just wondered, has anyone in Police Scotland raised that as an issue with the Scottish Government, and does Chief Superintendent Todd's reasoning for this fall in the detection rate sound credible to you?
I've not seen Andrew Todd, Chief Superintendent Todd's comments. I'm not going to address them directly, given that I've not seen them myself. Chief Superintendent Todd has participated in our resilience meetings over the last couple of days, and be very happy to discuss directly with him or others in Police Scotland if there are particular issues there that need to be addressed. But I'll probably have a closer look at that before saying any more. Thank you to everybody for joining us, from the journalists, and thanks to Fiona and Fiona for helping me with the questions today, and to Rachel, our BSL interpreter. Thank you to all of you for joining us. A couple of things to look out for over the weekend. There's no scheduled briefing over the weekend, but we will issue updates as necessary and appropriate on the Cooper Angus outbreak. We also hope to be in a position to issue an update on Aberdeen on Sunday, after we've had that midweek review that you've heard me speak about this week. In the meantime, can I wish all of you a pleasant weekend and appeal to you to remember to abide by all of the facts advice. Face coverings, avoid crowded places, clean your hands, clean hard surfaces, 2 metres distancing, and self-isolate and get a test if you have any symptoms. Thank you for joining us. I will see you again here at the usual time on Monday.